Well, I finally did it. I went to see Dr. Gordon Wilson at TLC for Gums for my first gum checkup. But I also found out that now there's some really good news for people that suffer from gum disease. And there's this exclusive procedure available at TLC for Gums that makes getting your smile back a lot easier and painless compared to the old methods of treatment. So, before my checkup, Dr. Wilson explained to me what gum disease is and gave me some details about his exclusive way of treating it that has changed thousands of lives.
Close. Put your lips together. All right. Like that. That's good.
Dr. Wilson of TLC for Gums. And I'm laughing here in a little bit because I'm very nervous, doctor, because we're about to show some stuff that is very sensitive to people to watch, but I'm laughing in a nervous way because this could be me or this could be someone out there right now. And when you see this, this is where you're taking care of those people who have pretty much, as you call them, deep pockets.
Correct.
Right? And explain deep pockets really quick.
So basically what happens is tartar begins to form at the neck of the tooth, and it releases toxins and poisons into the gums. The gums begin to pull away from the tooth, and you start to develop a pocket. Okay? And then you start to get bone loss over time, and you develop an even deeper pocket and deeper pocket and deeper pocket, because again, this never goes away on its own. The only way it's ever going to go away is if you A, remove the tartar, and B, prevent the tartar from ever reforming again.
Okay, let's walk through these pictures.
All right, so the next video that I'm about to show you, again, could be inappropriate for some of our viewers because it shows some surgical procedures, okay? So if blood and things like that make you squirmish, then you probably shouldn't be watching this. But if the non-surgical procedures that we talked about, the deep cleaning, does not work, then we're going to send you to the periodontist, where the periodontist will then cut the gums, peel the gums away from the root of the tooth and the bone to get better access. Then they'll go in and they will remove the tartar, and then they'll go in with their scissors and cut away any excess tissue, and then they'll go in and they'll stitch everything together. Okay.
Wow.
Now, in 2003, the World Health Organization released a report that said approximately 85% of adult Americans age 30 have either gingivitis or periodontitis. Okay. Putting a number to that, that's roughly 150 million Americans. Okay. Approximately half of them need this surgery. So about 75 million people need this surgery every year.
Wow.
Okay. Now, years ago, I used to refer to a periodontist for this procedure, and I ended up losing a lot of patients because nobody wanted to get this procedure done.
Yeah.
So what I did is I went out and I became one of the first 4 dentists in the world licensed to perform the only procedure in dentistry that's ever been patented. And what it does is it uses a laser instead of the scalpel and stitches. So what the laser does is the laser selectively separates the diseased gum tissue from the healthy gum tissue. Then I can go in and do my root planing and get all the tartar off the root of the tooth. And then I go in and I make a second pass of the laser, and what the second pass of the laser does is it heats up the blood so that the blood becomes sticky and those gum tissues will stick to the root of the tooth. So, when given the option between this and this, which would you pick?
Of course, your procedure.
The laser. Everybody picks the laser, okay? And the reason being is because the laser is minimally invasive. Because it is minimally invasive, there is little to no trauma to the gum tissues. Because there's little to no trauma to the gum tissues, there's going to be little to no swelling of the gum tissues. And because there's little to no swelling of the gum tissues, there's going to be little to no pain because swelling causes pain. We also have faster healing times. We know that tartar is the enemy, all right? And what is tartar? It's calcified plaque. Well, what is plaque? It's food and bacteria combined. So one day I asked myself, what if we had something to eliminate all the food particles after a meal and something else to kill all the bacteria? Because if there's no food and there's no bacteria, now there's no plaque. If there's no plaque, there can be no tartar, and if there's no tartar, there's no problem. So that's when I developed the TLC home care method of plaque control, and now everybody gets amazing results.
Doctor, what is the TLC for Gums home care for plaque?
Okay, so what we do is we recommend the HydroFloss to remove all the food particles from below the gum line, okay? Have you Have you ever used any kind of oral irrigator before?
No, I haven't.
Okay. Well, this is like a water pick on steroids. And the reason we recommend the Hydrofloss over the water pick is it has a magnet in the handle. And when that water passes through the magnet ionizes the water, giving the water the same electrical charge as the bacteria, and like charges repel. So this flushes out food particles the way a water pick does, but this repels bacteria in a way that the water pick cannot. Okay? That flushes out all the food particles, and then we have the Paratrace that kills all the bacteria.
Yeah. Let's talk about what the Paratrace does.
All right. So what the lab does is they create a little reservoir in the tray, and that's where the medicated gel goes. They create a ledge here, they create an extension here, so that when this part of the tray comes in contact with your gum tissues, it creates an airtight seal. And when this tray is fully seated, and this seal is fully engaged, the air pressure inside this chamber here is 6.5 times greater than the pressure of that crevicular flow coming out of there. So it's now going to push that medication all the way down to the base of the pocket, well beyond the reach of your toothbrush bristles and your floss. And after 15 minutes of wear time, you kill 99% of the anaerobic bacteria that cause tooth decay and 99% of the anaerobic bacteria that cause gum decay.
Okay.
So what we're going to do right now is we're going to take you back and we're going to do an examination. We're going to find out where you fall on my scale of 1 to 5, with 1 being the best and 5 being the worst. Once I know where you are on that scale of 1 to 5, I know exactly what needs to be done in order to get your gums healthy. And then once your gums are healthy, I'm going to show you a home care regimen that's going to keep them healthy for the rest of your life so that you never have to deal with this ever again.
Okay, you've never had to go on to 10, have you?
No.
No? Okay, so just 1 to 5.
Stops at 5.
Okay, let's go do it.
Let's go do it.
Okay, I'm here in the chair at TLC for Gums. Dr. Wilson's team is about to do my exam for me. So here we go.
All right, number 18 on the label. Here we go. 4, 3, 5, 4.
All right. That was pretty easy. You got me over my nerves. I'm pretty excited, pretty easy to do and everything. But I am excited to take care of this problem.
Okay.
And we're going to do it.
Yep, what I'm going to do right now is I'm going to put together a plan. We're going to figure out how much it costs, what our payment plans are, what our discounts are, what your insurance covers, and stuff like that. And then when you're ready to get started, we'll get started.
There you go. All right. To be continued. On to a beautiful smile.